Now, from where these nerves have come, after this class of brachial plexus, you will be able to know the source of these nerves. Now, brachial plexus, brachium means arm. This brachial plexus is situated adjacent to this arm. That's why it is called brachial plexus. Now, before starting the main topic, I want to give you some conception about the nerve. You know, there are 31 pairs of spinal nerve. Spinal nerves means they are coming from spinal cord. Another group of nerves that is known as cranial nerves. You have heard the name of cranial nerves. They are coming from where? Cranial nerves coming from where? Brain. More specifically, most of the cranial nerves are coming from brain stem, except two nerves, olfactory and optic. They are coming from the cerebral cortex. Otherwise, next 10 nerves out of 12, they are coming from brain stem. But spinal nerves are coming from spinal cord. Right? Now, here I will give a cross section of the spinal cord. Here you see. And this is lateral horn. Lateral horn. Now, from the anterior horn, some nerve fibers coming out like this, and from posterior horn, another fiber is coming. They are meeting to form mixed nerve. This is called spinal nerve. This is called root of the nerve. This is called root of the nerve. These two roots have joined to form mixed spinal nerve. There are 31 pairs of spinal nerve like this. Right? Now, again, this is called root. At the posterior root, there is a ganglion. Ganglion means collection of nerve cells. Here, that is called dorsal root ganglion. Dorsal root ganglion, DRG. Dorsal root ganglion. This is the efferent fibers and that is the afferent fibers. This is the mixed nerve, that is spinal nerves. These spinal nerves, after formation, how it comes out from the vertebral column. You know, Suppose I am drawing the one vertebral like this. This is the vertebral body. This is the here there is transverse process. Transverse process. It is lamina and it is spine. Lamina and spine. Right? It is the body. Body. This part, from here to this part is called neural arch. Neural arch is attached to the body by pedicle. This is called pedicle. Pedicle. So, at the junction of the pedicle and lamina comes out one process, transverse process. This is the transverse process, and where the two lamina meets, comes out the spinous process. So, this is the spinous process. This is transverse process. This foramen is known as vertebral foramen. Vertebral foramen. When 33 vertebrae will be come together, this foramen will be converted into a canal, vertebral canal, and through this vertebral canal passes, which is passes spinal cord. Now from to here this part is here. এখানে আছে এটা। Is a spinal cord. Now this spinal cord is coming from this spinal nerve is coming like this. Like this. This lamina, there is a notch. There is a notch within the lamina. Two lamina form side by side. If you vertebra joint, this laminal notch will form a foramen that is called intervertebral foramen. That is called intervertebral foramen. আর এখানে কি ছিল ভার্টিব্রাল ফোরামেন, এইখানে ছিল এটা ভার্টিব্রাল ফোরামেন আর এখানে হলো ইন্টারভার্টিব্রাল ফোরামেন। সো থ্রু দিস ইন্টারভার্টিব্রাল ফোরামেন কামস আউট স্পাইনাল নার্ভস। বুঝতে পারলি? ইজ ক্লিয়ার? So there are 31 pairs of spinal nerves. This is spinal nerves, I have told you. After coming out, they will again divide into two. One is called dorsal ramus. It is the dorsal aspect. Dorsal ramus. And it is called ventral ramus. Ventral ramus. And plural form of ramus is rami. So, two roots unite to form spinal nerve. That spinal nerve comes out through intervertebral foramen. After coming out from the intervertebral foramen, they will again divide into two, dorsal ramus and ventral ramus. Now, this ventral ramus only the ventral ramus will form plexus, nerve plexus, not dorsal ramus. Dorsal ramus will never form nerve plexus. Only ventral ramus will form nerve plexus. There are several nerve plexus. It is named according to the region. If it is in the neck region, there is cervical plexus. Then brachial plexus. When it is at the region of the lumbar plexus. at the region of the sacrum, sacral plexus. So there are several plexus. Now you have to know mainly this plexus, that is brachial plexus and lumbar plexus, most important. From the brachial plexus, the whole of the upper limb is supplied. Now let us see how this plexus is formed. This nerve plexus, brachial plexus, now how many spinal nerves are there? There are eight cervical nerves. There are 12 thoracic nerves. There are 5 lumbar nerves. There are 5 sacral nerves and 1 pair of coccygeal nerve. So total 31 pairs. Now out of these 31 pairs, cervical 5, 6, 7 and 8 plus thoracic, first thoracic nerve, these 5 nerves will form brachial plexus. Right? Now suppose this is the C5, cervical 5. C6, C7, C8 and T1. 1, 2, 3, 4, 5. These 5 nerves will form brachial plexus. Now, I have already told you it is the dorsal ramus and it is the ventral ramus. Hello? Hello? So, I have already told you the dorsal ramus will not form any plexus. Only the ventral rami will form plexus. Right? This each ventral ramus again will be divided into anterior and posterior branch. Right? So now this ventral ramus here we'll call it root. Here we'll call it root. Though actually it is not root. রুট তো আমি প্রথমে দেখিয়েছিলাম ওইটা রুট ছিল, প্রথমে রুট বেরোলো, রুট বেরিয়ে তারা একটা কমন স্পাইনাল নার্ভ করলো, কিন্তু এখানে আমি ধরছি এটা রুট। সো each root will be divided into 2 parts, anterior and posterior. I am using 2 color. Green color is the posterior root and blue color is the anterior root. Right? Now the C5 and C6, their anterior division will join. And anterior division from the C8 and T1 will join. And C7 will be continued alone. Now after joining, the root after joining will form what it will form? Trunk. So there are 3 trunks. Here you see The anterior division of the C5 and C6 join to form upper trunk, and C7 anterior division has formed middle trunk, and anterior division of C8 and T1 has formed lower trunk. So there are 3 trunks, right? Now this trunk, you should make some correction. Actually, the division, first the root will form to trunk. So 5 and 6 they have formed upper trunk. C7 has been continued as a middle trunk, and C8 T1 has formed to lower trunk. Now trunk will divide. Trunk will divide. Now let us divide anterior and posterior. Anterior, posterior. Now all posterior division. Now this all posterior division again will meet to form posterior cord. All posterior division will meet to form posterior cord. Right. All posterior division will meet to form posterior cord. Now anterior division of the middle trunk and upper trunk, they will meet to form lateral cord. This one and this one form lateral cord. And anterior division of the lower trunk will be continued as medial cord. I am again repeating. First of all, root. You know, after root comes trunk. So there are 5, 6, 7, 8, T1. There are 5 roots. Out of these 5 and 6 roots have joined to form upper trunk, and C8 and T1. C8 and T1 has formed lower trunk, and C7 has been continued as middle trunk. Now these trunk again have divided into anterior and posterior branch. All posterior branch has united to form posterior cord, and the posterior branch of the middle trunk and upper trunk has formed lateral cord, and the anterior anterior division of the lower trunk has continued as a medial cord. So there are 3 cords. Now, how they have been named as lateral, posterior and medial cord. Why? In respect of which this naming has been done in respect of which? In respect of second part of the axillary artery. Axillary artery, you know, is divided into 3 parts. Axillary artery, where it starts from the outer margin of the first rib. It is actually the continuation of the subclavian artery. From there up to the upper margin of the pectoralis minor is the first part. Deep to pectoralis minor is known as second part, and beyond the pectoralis minor is called the third part. Third part extends up to the lower margin of the teres major. Now this second part of the axillary artery, here this lateral cord lies laterally, posterior cord lies posteriorly, and medial cord lies medially in respect of this second part of the axillary artery. So it has named according to its position to the second part of the axillary artery. Clear? Now, up to this formation of root, trunk and division. Root, it is trunk and division. All these occurs within the neck, above clavicle, within the posterior triangle of the neck, and cord is formed below the clavicle. তাহলে আমরা cord গুলো পাবো কোথায়? axilla তে পাবো. We'll get it within the axilla, right? Now you have to memorize the branches of all these cords, right? Now let us see what are the branches of the lateral cord. What branches it gives off? Lateral cord, first branch it gives off is lateral pectoral nerve. Lateral pectoral nerve. Where have you seen this lateral pectoral nerve? Where have you seen? Decision हो गया. Where you have seen? You are acquainted with this nerve, lateral pectoral nerve. This lateral pectoral nerve has pierced one important fascia, that is clavipectoral fascia. Only one question if you are asked about clavipectoral fascia, and that is what structures pierce clavipectoral fascia. There are 3 structures that pierce clavipectoral fascia. One is lateral pectoral nerve, number 2 acromothoracic artery বা thoracoacromial artery, and number 3 cephalic vein. You will memorize it, cephalic vein. Now this is the lateral pectoral nerve. So lateral pectoral nerve, if you are asked, it is coming from where? It is coming from lateral cord, right? Then another important branch it gives off, that is musculocutaneous. Musculocutaneous. Musculocutaneous means it supply muscle as well as skin. Skin supply means sensory part. So it is mixed nerve. Mixed nerve means it has both components, motor component as well as sensory component. Which muscles supply this musculocutaneous nerve? all muscles of the arm, that is biceps brachii, deep to biceps brachii, brachialis and coracobrachialis. All these three muscles of the arm supplied by musculocutaneous nerve. Then this musculocutaneous nerve continued as medial cutaneous nerve of the forearm. This is continued as medial or lateral. It will continue the lateral cutaneous nerve of the forearm, not medial. So musculocutaneous nerve supplies all the muscles of the front of the arm, that is biceps, deep to biceps lies brachialis and coracobrachialis. These three muscles, after supplying it, it comes out and continued as lateral cutaneous nerve of the forearm. Now, third branch. Third branch means continuation. Continuation of it. It is the lateral root of the median nerve. Lateral cord so gives up three branches. One is lateral pectoral, one is musculocutaneous, and a lateral root of the median nerve. Now come to the medial cord. Medial cord gives off one branch, that is medial pectoral nerve. This is medial pectoral nerve. So there are two nerves, medial pectoral nerve and lateral pectoral nerve. These two pectoral nerves supplies which muscle? Which muscle they supply? They supply these two pectoral muscle, pectoralis major as well as pectoralis minor. These two nerves supply both muscles. Out of these two nerves, only one pierces the clavipectoral fascia, that is lateral pectoral nerve, and medial pectoral nerve pierces the pectoralis minor. It does not pierce the fascia, but it pierces the pectoralis minor that lies deep to pectoralis major. Right? Now, second nerve, medial pectoral nerve. Now, second nerve is medial cutaneous nerve of the arm. Medial cutaneous nerve of the arm, second branch. Medial cutaneous nerve of arm. Another nerve it gives off, that is medial cutaneous nerve of forearm. Medial cutaneous nerve of the forearm. কটা হলো? Medial pectoral, medial cutaneous of the arm, medial cutaneous of the forearm, and then it will, before continue, it will give up another important root, that is the medial root of the median nerve. So medial root of the median nerve, medial root of the median nerve, these two roots will meet to form median nerve, and it will be continued as ulnar nerve. Ulnar nerve. Hey, Mr. You, what are you talking about? What are you talking about? If you don't have any interest, you may go out. I will ask you a question again. So medial cord has given off 5 branches. First, medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous of the forearm, and medial root of the median nerve, and then it is continued as ulnar nerve. Right? Without memorizing this plexus, you should never enter into your examination hall. It is so important. That's why it is being discussed in lecture class. Now, branches of the posterior cord. Posterior cord gives off following branches. First one is upper subscapular. Upper subscapular. Upper subscapular. Upper subscapular. There is a subscapular muscle. It supplies upper subscapular. Then thoracodorsal. 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 Then lower subscapular. Then lower subscapular. And ultimately it gives two terminal division. One is axillary nerve and it is continued as radial nerve. Radial nerve. Again here 5 branches. So medial cord gives up 5 branches, posterior cord gives up 5 branches, lateral cord 3 branches. Out of 5 branches, upper subscapular, thoracodorsal, lower subscapular, axillary and radial. All these nerves you will gradually see in the dissection of the upper limb. Now you will be asked its root value. Its root value. What is root value? Root value means suppose this is the spinal cord. Suppose one nerve is coming here, over here. One spinal nerve. So this part called one segment. So there are several segments. Now you have to mention from which segment this nerve is coming. That is called root value. As for example, in case of medial nerve and in case of radial nerve, their root value from 5 to T1. From all segments they have taken their fibers. So root value of the radial nerve, if you are asked, you will say 5, 6, 7, 8, T1. Root value of medial nerve 5, 6, 7, 8, T1. That means there is contribution from all segments from C5 to T1. Likewise, radial nerve also, their root value is 5, 6, 7, 8, T1. মেন নার্ভের রুট ভ্যালু জেনে রাখবি, মেন নার্ভগুলোর বিশেষ করে। আলনার নার্ভের রুট ভ্যালু হচ্ছে C7, 8, T1। আলনার নার্ভে হচ্ছে C7, 8 আর T1। 5, 6 এর কোনো ফাইবার এখানে নেই। 7, 8, T1। 7, 8 আর T1। musculocutaneous nerve 5, 6, 7। musculocutaneous root value হচ্ছে C5, 6, 7। বুঝতে পারলি? Apart from this, another important nerve which comes out from the root of the brachial plexus. Here it is root. Here it is root 5, 6, 7, 8, T1. One important nerve comes out from the it has contribution from C5, C6 and C7 from this root. তাহলে রুট ভ্যালু কি হবে? 5, 6, 7। It has taken its origin from root 5, 6, 7. This important nerve lies on the lateral wall of the chest. They are known as long thoracic nerve. Very important nerve. Very applied importance. For applied importance is very much important. This nerve is known as long thoracic nerve or nerve of Bell. Or nerve of Bell. It supplies. Here lies one important muscle that is called serratus anterior. Serratus anterior. This muscle it supplies. The serratus anterior muscle is supplied by which nerve? Nerve of Bell or long thoracic nerve. Right? Another important nerve comes out from the trunk, upper trunk. This is the upper trunk that is known as suprascapular nerve. Suprascapular nerve. Another nerve comes out, nerve to subclavius. Nerve to subclavius. Subclavius. Right. Another nerve comes out from the C5 root, that is dorsal scapular. Dorsal scapular. Suprascapular nerve. তোদের তো স্ক্যাপুলা হয়ে গেছে, স্ক্যাপুলা বোনটা হয়ে যায়, স্ক্যাপুলা পড়ানো হয়েছে, স্ক্যাপুলা হয়ে যায় পড়ানো তো হ্যাভ ইউ সিন দ্য স্ক্যাপুলার নচ? হ্যাভ ইউ সিন স্ক্যাপুলার নচ? where scapular notch is situated? Superior border there একটা খাঁজ আছে, scapular notch. Through this scapular notch suprascapular nerve passes. Now these are the nerves coming out from the brachial plexus. এগুলো মনে না থাকলেও মানে মোটামুটি মনে রাখতে হবে, সবগুলো মনে রাখতে হবে, সব নার্ভগুলো মনে রাখতে হবে, নিজে নিজে আঁকবি, বাড়ি গিয়ে ইউ উইল ড্র ইট অ্যান্ড you will fix it on the wall in front of you and you will see, রোজ পড়বি, দেন মনে আসবে আর কি, বুঝতে পারলি? Now applied importance. First let us see the applied importance of long thoracic nerve of Bell. This long thoracic nerve of Bell, I have already told you that it supplies the serratus anterior muscle. Serratus anterior muscle, long thoracic nerve. This nerve may be injured. Where? If there is any stab injury, but mostly it is injured during operation of the breast, especially carcinoma breast. During operation of the carcinoma breast, extensive tissue is incised, so during the incision of the tissue, that nerve may be injured. If this nerve is injured, how will you diagnose? The patient, especially the lady, will not be able to comb her hair. He will not be able to raise his hand above head. If she complains like that, you should ask her, you push the wall. If she pushes the wall, you will see, and from behind that the medial border of the scapula will stand out. উঁচু হয়ে উঠে আসবে, will stand out because serratus anterior has been injured, he has been paralyzed. So serratus anterior কি করতো, it keep the scapula attached to the chest wall, chest wall সঙ্গে attached রাখতো, এটা it keep it fixed with the chest wall. As there is no such fixation power, as this nerve supplies the serratus anterior has been paralyzed, so the unopposed action of the এখানে একটা মাসল আছে trapezius and rhomboidus, their unopposed action raises the medial border of the scapula. এই কন্ডিশনটার নাম হচ্ছে উইঙ্গিং অফ স্ক্যাপুলা, উইঙ্গিং অফ স্ক্যাপুলা। উইঙ্গিং অফ স্ক্যাপুলা। মনে থাকবে? তাহলে উইঙ্গিং অফ স্ক্যাপুলা ইজ এ কন্ডিশন where there will be lesion of the lateral thoracic long thoracic nerve of bell. Now come to the another important condition, that is two important diseases related to, apart from this, Arb palsy and Klumpke's palsy. Arb palsy and Klumpke's palsy. Arb, E-R-B, Arb's palsy, palsy or paralysis. আর একটা হচ্ছে 2 নম্বর হচ্ছে Klumpke's palsy, K-L-U-M-P-E, Klumpke's. Klumpke's palsy. Klumpke's palsy. There are two palsy. There is a point, that is the arc point. What is that arc point? Here you see this part. This part. 5 root, C6 root, suprascapular nerve, nerve to subclavius, and there are anterior division and posterior division. This part is known as Arb's point. This Arb's point may be injured. If there is injury, one injury, that is, if this angle between the neck and shoulder, this angle, if it is excessively stretched, কি কারণে excessively stretched হতে পারে যে অ্যাঙ্গেলটা? কি কারণ হতে পারে? এই ছবিটা রাখো তো এবার। In what condition this angle may be excessively stretched? যদি এরকমভাবে ঘাড় কাত হয়ে পড়ে যাস, একটা অটোমোবাইল অ্যাক্সিডেন্ট যদি এমনভাবে পড়লি, এরকমভাবে পড়লি, এদিক দিয়ে ঘাটা চলে, এদিক দিয়ে চলে এলো, বুঝতে পারলি? সেক্ষেত্রে আর একটা হচ্ছে স্যার, at the time of delivery, childbirth, the hand has come out first, and if you pull hand, head is within the uterus, you are pulling the next, you are pulling the next, দেখাও নেক্সটটা, হ্যাঁ ওটা আগেরটা, হ্যাঁ না ওটা না, তারপরটা, হ্যাঁ এটা দেখো, এখানে দেখ, ভালো ছবিটা পরিষ্কার আসছে না তো? পরিষ্কার আসছে রে? ক্লিয়ার না? আচ্ছা, এখানে দেখ, এই যে নেকটা কিভাবে পড়েছে দেখছি তো? তাহলে এই অ্যাঙ্গেলটা এরকম পড়লে বেরিয়ে যাচ্ছে। আবার এখানে দেখ, বাচ্চাটার হাতটাকে বেরিয়ে এসছে, হাতটা টানছে, হ্যাঁ, তাহলে হাতটা যদি টানিস তাহলে এটা অ্যাঙ্গেলটা বেড়ে যাবে। ইন দ্যাট কেস দেয়ার উইল বি চান্স অফ ইঞ্জুরি অফ দ্য আর্স পয়েন্ট। আর্স পয়েন্ট ইঞ্জুরি হওয়া মানে এই 5-6 এই যে 5-6 যেটা আছে আর কি, এই 5 and 6 যেসব নার্ভের মধ্যে দিয়ে গিয়েছে, এই 5 and 6 ফাইবারগুলো যে নার্ভের মধ্যে দিয়ে গিয়েছে সেই সব নার্ভগুলো প্যারালাইজ হয়ে যাবে। All nerves containing 5 and 6 segment will be paralyzed. Now, what are the muscles that supplied by the nerves carrying C5 and C6 fiber? একটা হচ্ছে deltoid muscle. Deltoid muscle is supplied by axillary nerve, or axillary nerve contains C5 and C6. C5 and C6. So axillary nerve supplies deltoid. This is what is the name of this muscle? Biceps is supplied by musculocutaneous. Musculocutaneous 5, 6 আছে, 7 ও আছে, 5, 6, 7 I have already told you. So musculocutaneous supply, so this muscle will be paralyzed. নিচে হচ্ছে brachialis, brachioradialis, all these muscles will be paralyzed. And suprascapular nerve supplies muscles of the scapula, that is supraspinatus and infraspinatus. All these muscles will be paralyzed. Now, what will be the effect of this paralysis? Number 1, the position of the hand of the patient will be like this. Hand will be extended and attached to the body wall, and hand should be pronated, and fingers should be like this. এরকম এটাকে বলে পুলিশম্যান টিপস বা ওয়েটার টিপস, মানে পুলিশ যেন টিপস চাইছে, টিপস তো এমনি চাই না, লুকিয়ে চাই, হ্যাঁ, তাহলে এরকম লুকিয়ে চাই, ওয়েটারগুলো লুকিয়ে চাই, এটাকে বলে পুলিশম্যান টিপস। বুঝলি তো? এরকম পজিশন থাকবে বাচ্চা যখন বড় হবে তখন এরকম হবে, আর যদি এমনি বড় মানুষের হয়, ইফ অ্যাডাল্ট, তাহলে এরকম হবে। কেন? এবার কেন তার ব্যাখ্যাটা দেয়। This is the biceps causes flexion, so biceps is paralyzed, there will be no flexion, so elbow will be extended, right? Now teres minor and supraspinatus muscle, they are called lateral rotators. So there will be no lateral rotation, there will be medial rotation. So heart will be pronated like this, and supinator muscle will also be affected. So there will be no supination, patient will not be able to supinate his arm, so it line pronated. বুঝতে পারলি? তাহলে আর এই হচ্ছে তোর deltoid causes abduction, so abduction is lost, that means patient will be adducted. আগে মাসেলসগুলো মনে রাখবি, তারপর তাদের অ্যাকশনগুলো মনে রাখবি। ফার্স্ট হচ্ছে deltoid, so abduction will not be there, so adducted, supinator muscle gone, so hand will be pronated. বুঝতে পারলি? তাহলে এইভাবে তুই বুঝতে পারলি, তাহলে কীভাবে এটা এক্সপ্লেনটা করছি। তাহলে এটা বলবি আর্স পলসিটা প্রথমে বলবি, আর্স পলসি হচ্ছে কজটা কি বলবি, ডিউ টু এক্সেসিভ স্ট্রেচিং বিটুইন দ্য হেড অ্যান্ড শোল্ডার। কোন কন্ডিশন হতে পারে? এক নম্বর হচ্ছে রোড অ্যাক্সিডেন্ট, 2 নম্বর হতে পারে অ্যাট দ্য টাইম অফ ডেলিভারি, হ্যাঁ, এটা গেল তোর আর্স পলসি। এবার আয় ক্লাম্পকিস প্যারালিসিস। ক্লাম্পকিস এর উল্টোটা, এই অ্যাঙ্গেলটা বিটুইন দ্য অ্যাঙ্গেল বিটুইন হ্যান্ড অ্যান্ড বডি ওয়াল, এই অ্যাঙ্গেলটা, এটা কী করে হতে পারে? হাইপার এক্সটেন্ডেড। ধর একটা সামওয়ান ইজ ফলিং ফ্রম ট্রি, হঠাৎ করে একটা গাছের ডালটা ধরে ফেললো আর কি, পড়তে, তাহলে হঠাৎ করে ঝাঁকার লেগে এটা হয়ে গেল স্ট্রেচ, বুঝতে পারলি? এটা হয়ে গেল। আর একটা হতে পারে অ্যাট দ্য টাইম অফ ডেলিভারি, ব্রিচ ডেলিভারি। ব্রিচ মানে আমাদের জেনারেলি ডেলিভারির সময় আগে মাথাটা আসে, পরে পেছন দিকটা আসে, পেছন দিকটা আগে বেরিয়ে এলো আর কি। ধর তারপরে তুই ধর পেছন দিকটা খুব জোরে টান দিলি, হাতটা এরকম হয়ে আসে, তাহলে এখানে এক্সেসিভ স্ট্রেচিং হলো, তাহলে হতে পারে ক্লাম্পকিস প্যারালিসিস। ক্লাম্পকিস প্যারালিসিসে নার্ভ ফাইবার যেটা ইনভলভ হয়, দ্যাট ইজ C8 and T1 fiber. C8 and T1 fiber. C8 and T1 fibers actually is mainly passing through the ulnar nerve. বুঝতে পারলি? ulnar nerve. And ulnar nerve, and also it is passing through median nerve. Median nerve তো একদম C5 থেকে মানে T1 পর্যন্ত, C5 থেকে T1, তো এর মধ্যেও C8 T1 আছে, বুঝতে পারলি? তাহলে মেনলি C8 and T1 fibers will be injured, and that is the mainly the carried by ulnar nerve, and ulnar nerve supplies all the small muscles of the hand. Ulnar nerve is also called musician nerve. Musician nerve কেন বলে? মিউজিশিয়ানরা তো ফাইন ইনস্ট্রুমেন্ট বাজায় না, তাহলে ফাইন মুভমেন্টের জন্য আলনার নার্ভ। আর লেবারাস নার্ভ কাকে বলে? মিডিয়ান নার্ভ। মিডিয়ান নার্ভ বড় বড় মাসুলটা সাপ্লাই করছে এখানকার, এই যে লং ফ্লেক্সারগুলো সাপ্লাই করে, সেই জন্য এখানে লেবারাস নার্ভ মানুষ বলে। তাহলে বোথ নার্ভস, আলনার অ্যাজ ওয়েল অ্যাজ সাম পোর্শন অফ দ্য মিডিয়ান নার্ভ উইল ইনজিওর্ড। তাহলে কী হবে? হাতের যে মাসেলসগুলো আছে, ছোটো ছোটো মাসেলস, দে আর নোন অ্যাজ lumbricals and interossei muscles. Lumbricals and interossei muscle, dorsal interossei and plantar interossei and lumbrical muscles. These muscles, what movement it causes? It causes normally flexion of the metacarpophalangeal joint, eta, and extension of the interphalangeal joints, eta. এই মুভমেন্টটা করে flexion of the metacarpophalangeal and extension of the interphalangeal joint, এরকম করে। এবার ধর এটা ইনজোর্ড হয়ে গেছে, তাহলে এবার উল্টো মুভমেন্ট হবে। as these muscles have injured, interossei and lumbricals injured, so there will be reverse movement. তাহলে কি হবে? this flexion movement will be extended, তাহলে metacarpophalangeal movement will be hyper extended and interphalangeal will be hyper flexed. তাহলে এরকম হয়ে যাবে। lateral four fingers will be like this, and also the wrist joint, long flexors supplied by the median nerve, it causes flexion of the wrist, that is also to some extent injured, so there will be hyper extension of the flexion wrist joint. তাহলে wrist joint খানিকটা extension plus এই, এটাকে বলে ক্রয়িং বা ক্ল হ্যান্ড, CLAW, ক্ল হ্যান্ড,